An upcoming event is combining heritage and health to spotlight Juneteenth and World Sickle Cell Day. It's a health fair and summit happening this weekend in 5th Ward. Joining us live to explain more is Dr. Tomia Austin, Executive Director of As One Foundation. Good morning. Thank you so much for your time this morning.
Good morning, Zach. Thank you so much for having me.
Talk to us, Dr. Austin, about As One Foundation and how the organization is involved with this event and getting the word out for people to know more information.
Well, the As One Foundation, our mission is to empower families globally, delivering life-saving sickle cell education. That mission comes about as a result of former Texan, DeVar Darling, losing his identical twin brother, Devon, to sickle cell trait exertion when they were football players at Florida State back in 2001. So fast forward to 2024, where we are today. June 19th is World Sickle Cell Day. June 19th is also Juneteenth. Two pivotal moments in Black heritage that fall on the same day, that are recognized federally, nationally, and certainly locally right here in the state of Texas. So we decided to lean in to the importance of this heritage, this legacy, this resiliency of the Black community by also doing what we need to do to raise awareness about sickle cell and sickle cell trait, which we certainly believe could have played a significant role in saving Devon's life had his coaches known the education that we disseminate. So on the 15th, not the 19th, but on the 15th, on Saturday at the 5th Ward Multi-Service Center, we're having a summit, an education summit about the curative therapies that have been announced about sickle cell, along with some disease-modifying therapies. So this is definitely for the sickle cell community, but it's also for the greater community. We're having a health fair, a blood drive, vaccinations, screenings. I hear there's a lot of prizes that will be awarded. So all you got to do to win is to register. Our website hopefully will be on the screen, but I'll read it off so that it's a free registration, and you show up. The website is tinyurl.com/as1sc summit, and you register, show up, you have a ticket, and you could win a gaming system, a flat screen TV, even some cash prizes. This is for the community, with a party with a purpose kind of thing. Vendors, so the whole entire family is invited. People with sickle cell are aging, so we're addressing all of the needs along the spectrum. And everyone's invited. We hope we'll see you there from 11 to 3 Saturday, June 5th at the 5th Ward Multi-Service Center.
Dr. Austin, talk a little bit more about sickle cell. For people not familiar with the condition, what is it and who does it impact at large?
Well, thanks for that question, because there are certainly a lot of assumptions out there, a lot of myths. But sickle cell is a genetic disorder that affects people predominantly of African descent. However, it definitely also affects people of Asian, Indian, Latin, Italian, Mediterranean, Greek, or Turkish descent. So literally anyone could have sickle cell. It is a blood condition. It is not a skin color condition. It basically is a defect in one gene, speaking genetically, that causes blood cells to sickle, to clot, to cause blockages. And on the extreme, we hear a lot about crises, hospitalizations, strokes. But what we don't hear enough about is the fact that sickle cell trait, which usually takes two parents that have sickle cell trait to birth a child with sickle cell disease, can also be symptomatic. And that's in fact what happened to our founder's brother. DeVar, of course, the living twin, also lives with sickle cell trait every single day and has to practice things like hydration. When we educate in schools, we educate young people to warm up, to drink up, and to rest up, because red blood cells, when they are sickled, take double the time and sometimes longer to generate in a person's body. So often you'll hear people with sickle cell trait described as lazy or not committed, when in fact the science in their blood is not letting them recover as fast as a person with normal hemoglobin or without sickle cell. So sickle cell disease and sickle cell trait, two different things, but they're all in the same family along the same spectrum. And we educate about both. We educate doctors, we educate nurses, and we certainly educate school nurses, young people in school, and parents, because it's one big happy family, but the more we know, the better we're off. And one of the bigger things is all you need to do is have a blood test to find out if you are positive for sickle cell disease or sickle cell trait. We certainly have newborn screenings here in the United States that each child that's born post 1995 will be tested for sickle cell trait and sickle cell disease or trait. And in the event that they are diagnosed with sickle cell disease, they're connected to a hematologist and a whole team of doctors. But sickle cell trait, not so much. And it's important because 97% of sickle cell disease births are born to two parents who didn't know that they had sickle cell trait. So that's why testing is important. And we, hope to be able to offer, unlimited screenings, free screenings. So people who may be curious, or if you know that you have sickle cell in your family, the likelihood is higher that you might have sickle cell because that's the only way. It is not contagious. It is genetically passed down.
I love having conversations like this because I think, one, it eradicates the stigma, right, associated with the disease and the condition. And two, also, it reminds people, while eradicating the stigma, it reminds people that this disease is not a death sentence. So the more we talk about it, the more apt we're able to attract people to the conversation, to invite people in to have conversations like this, for them to know that screening exists, treatment exists, and it makes us a better community.
You're absolutely right. I really appreciate you saying that so eloquently. It is not a death sentence. No one, especially from sickle cell trait, but unfortunately we continue to have athlete deaths, and they can be prevented. When you go out to work out, unfortunately, there's an alarming statistic that shows that sickle cell trait exertion death happens on the first day of conditioning workouts within the first hour. But if they went from rest to exertion gradually, the warm up, if they hydrated before, during, and after physical activity, and that hydration is also, we subscribe to consuming half your body weight in ounces of water daily to avoid dehydration. That's the drink up. And then be allowed recovery breaks. They got to be allowed to take a knee. They have to be allowed to put their hands on their hips, or that cobra pose. That is the rest up. Devon was not allowed recovery. You cannot go from one circuit to the next, to the next, to the next without breaks in between. Warm up, drink up, rest up. That is the simple message for our young people. And I'm also, even our labor force, those of us that have sickle cell trait that work
construction,
in, outdoors, in labor positions. Warm up, drink up, rest up is applicable to you too. It does not have to take a life. And the good news is about sickle cell disease, people are aging. People are living well into their 70s and 80s. I got to participate in a presentation yesterday about menopause and sickle cell disease. So that tells you
it's remarkable
that life expectancy of less than 20 years old, that's a thing of the past now. People are living. And as you just said, it's not a death sentence. It's precautions we need to take, and hydration is a major one of them.
Living longer while also living healthy. Dr. Austin, we so much appreciate your time this morning. Thank you so much for having this conversation on this show with us today.
Thank you for the opportunity. We'll see you Saturday.
See you Saturday. Thank you again, Dr. Austin.